A very warm welcome to our Newcastle Family History Society member, Louise Evans, who has prepared an extremely interesting talk for us today. Louise has a background in healthcare and, together with her interest in both history and family history, provides us with a wonderful overview of medical advances through the ages, coupled with information which will assist us in our research. Please welcome Louise as she guides us through the maze of medical terms and facts from Hippocrates to modern day.
Well, good evening, everybody. I'm very pleased to be here tonight. I was supposed to give this presentation last September, but unfortunately on the day of the meeting came down with COVID and I was not in any fit state to actually do any talking at all. So the topic of tonight's talk is from Hippocrates to the modern day, medical terms and facts. So the aims of tonight's presentation is to provide an understanding of some key medical advances and also to inform family historians researching various relevant documents. But I also believe I'll learn a lot from you, okay? So just tonight's talk is actually in 3 parts. So part 1 is really setting the scene. And this is where we're going to look at some relevant scientific or medical facts for anybody interested in history. And then in part 2, we'll talk about some prefixes, suffixes, word roots or root words, common abbreviations and trend health data. And then part 3 is about obsolete terms for diseases. So just a little bit about myself. I am a registered nurse, although at the moment I'm non-practicing. I've been happily retired for 7 years. I'm not a doctor, I'm not an expert in anything, but I do have an interest in history and particularly family history. I've worked both here and overseas, and I actually was in England for 4 years and I had a very memorable time. During my nursing career, I have had some really memorable patients that I've never forgotten. I've looked after some maximum security prisoners and they were certainly on their best behaviour. They knew that they were getting better care from me and attention than what they got at Wombo Jail. Also those in intensive care with tetanus, those on an iron lung because of their polio, major gunshot wounds and delivery babies at home. When I was in Oxford, I actually did cycle around on a bicycle like that, but without the flowers in the basket. I actually had a nice blue bag, which is actually pictured there. And this picture on the right, that is what an iron lung looked like, and not a very pleasant way to live your life. I did a lot of strategic health planning. That was in the last 12 years of my working life, and also worked in health promotion and research across all the clinical areas from pre-birth to death, as well as an educator and as a private consultant. And I'm really pleased to be able to say I've enjoyed it all. I had a ball during my career and it went for almost 50 years. So just tonight, I thought we'd start with the subject of autopsy, because I actually thought that was quite interesting. So that is from the Greek word, and it means to see for oneself. And the first autopsy was done 300 BC in Alexandria. But it wasn't until 1,000 years later in 1302 that the first legal autopsy ordered by a magistrate was done in Bologna, Italy. Autopsy was considered a crime by the Catholic Church, but they did eventually become more accepting. And then in the 1700s, it was more commonly performed, but unfortunately it led to the crime of grave robbing. And you might have heard of that term, the resurrection men. They were the grave robbers. Also, the Italians have a term called tombaroli. And it was a common occurrence and doctors needed to practice. Unfortunately, but they did, and the government did turn a blind eye. Now, this picture here is from a graveyard in West Sussex in England, and wealthy family members could actually afford to have the graves, you know, encased with bricks and mortar, and that was to try to keep the grave robbers away. And this next one is a metal mort safe, and that's in from Scotland, that one. The government did turn a blind eye, but their families did want their loved ones to rest in peace. And some say that's where that term came from, rest in peace. So I don't know if you've heard any other feedback about that term, but this is the issue of grave robbing. Autopsies led to a greater understanding of human anatomy and causation of disease and improvements in medical science. And I was actually quite interested in this topic of autopsy. And then I thought, well, I better look at Hippocrates. And, you know, he's regarded as the father of medicine. And he was born in 460 BCE. So prior to various medical advances, and some of which we're going to talk about tonight, Hippocrates felt the human body consisted of 4 substances or humours, and you've probably heard of the black bile, the yellow bile, the blood and the phlegm. And for ideal health, they have to be in perfect balance. And you had human characteristics. So if you were predominantly had the humour of black bile, you were melancholic, sensitive and artistic, or yellow bile, you were passionate and energetic. Blood, you were confident and joyful, etc. But phlegm, you were a deep thinker and calm. So I suppose you have all heard about the 4 humours, but autopsies disproved Hippocrates' theory of the 4 humours. And in fact, Paracelsus, the father of toxicology, who was born about 1,000 years later, was the first to discredit the humours. Now, you might think, well, is an autopsy the same as a post-mortem? And yes, it is. It can be full or limited. And a full autopsy involves examination and testing of body organs and tissues and possible retention of some of these for more detailed analysis. And, you know, sometimes samples are sent even overseas. And a limited post-mortem is performed when the next of kin has set limits. For example, they might just want an external examination or just some testing on a small amount of tissue, or limited to certain areas of the body. And just some current facts about autopsy. The rates of autopsy are dropping. 50 years ago in Australia, about 50% of deaths were actually autopsied, but that rate has dropped to 15%. But in the UK and the US, it's even, you know, a smaller percentage. And it's actually felt that because so many people, you know, do have a lot of medical intervention towards the end, you know, particularly with doctor's visits and pathology and radiology, that an autopsy doesn't add much value to the doctor being able to certify, you know, the actual cause of death. So the rates are dropping. Just some other facts. The senior next of kin does have the right to object, but they actually have to do a written a request that a coroner not authorise an autopsy. And the coroner will consider the objection along with the circumstances, but then it's up to the coroner to decide whether to proceed or not. And then if the coroner believes that an autopsy is required, the senior next of kin can actually apply to the Supreme Court. But I actually couldn't get any information about how often, you know, somebody would take it that far to the Supreme Court. So they're coronial or non-coronial, and generally if a person dies from an unknown or unnatural cause, or you know, accident, result of a crime, or if they're living in an institution like a jail, that would be a coronial autopsy. But a non-coronial requires consent either from the person who gave it when they were still alive, so i.e. in their advanced care directive, or their senior next of kin after death. So they're the 2 types of autopsies. So what were some other medical advances that we'll look at tonight? And one is microscopes and the other is radiology. So the first microscope was developed in the 1590s by the Dutch father and son, the Jansens. And then in the 1600s, we had other people like Van Leeuwenhoek, Hook and Kircher, who observed cells. However, significant improvements were needed, particularly with the focusing. But around the 1830s, microscopes were more used more widely in medicine. Now, this is a picture here of the Cook microscope from 1670. And then in this next slide, I've got a picture of Van Leeuwenhoek here, and he was the first to observe bacteria or protozoa. And he actually developed hundreds of microscopes, and they were very small. You possibly can see he's actually holding his microscope to his eye, and they're about 5 centimetres long and 2.5 centimetres wide. So that was just a little bit about microscopes. Now, X-rays in 1896, and this is the first X-ray machine. So an X-ray was first used to diagnose a fractured wrist, and that was on a young child. So you might think, well, in earlier times, how did doctors diagnose? Well, they did things like they would drink the patient's urine. Luckily, that is sort of obsolete now, but if it was sweet like honey, that's where the phrase diabetes mellitus came from. So, so they could tell that that was a diabetic patient, or they would smell the patient, and if they could smell like bitter almond smell around the mouth, that was a sign of cyanide poisoning. Or if the urine smelled fishy, that was a sign of a urinary tract infection. Or they might observe the patient, you know, falling down, and that's a sign of a stroke. Or they'd take their pulse, feel for a fever, look at the skin colour, or they'd listen to the chest and heart. Now, a stethoscope, they were developed by a French doctor who actually thought it was impolite for himself to put his ear to the chest of a lady. So he actually developed the stethoscope so his head could be further away from the chest area. So medical and scientific advances relating to diagnosis led to the need for consistency with medical terminology. And so this is where we come on to just part 2, but I just sort of wanted to ask if there were any questions to date on part 1. Anything at all?
Well, I was just wondering when the issues with the coronial inquiries came up, is that the same across the board, say the UK and Australia?
Oh, but not necessarily.
Yeah.
What I presented was the Australian
Right.
facts.
Yeah, thanks. I was wondering.
Yeah.
Because
So
we sort of see things on the telly like silent witness and the coroner, and you know, there are
yeah.
a
And
few
I'm thinking
bits
if
and pieces.
it's around 1% are all on the TV.
Thanks.
Okay, now you probably are all aware that the prefix comes first. And I'm going to give you an example in the next slide, and I think that it will illuminate it better. So the root word is in the middle of the word, and the suffix comes last. Now, if I just give you this example of myocarditis, so the prefix is specifying the location, in this case, MY means muscle. And then the root word is the general location, cardio, which is heart. And then the suffix is describing the features, in this case, itis, which is inflammation. So if you put that word together, it's the muscle layer of the heart that is inflamed. And the O is what we call a combining form. And of course, you know, there is lots of words that just really have, you know, like a word like hematology, it really is only heme and tology. So heme relating to the blood, and the ology relating to knowledge or the field of study. So they don't all have a prefix, a root word and a suffix, but anyway, I know I've got some examples of prefixes and suffixes. I wasn't going to include them all because it would get terribly boring, because there'd literally be, you know, probably hundreds of them. But I have included some of them, and we might just look at, you know, a few on each slide. So algia, you've probably heard of people with myalgia or neuralgia. So the myalgia is the muscle pain, and the neuralgia is the nerve pain. Or, you know, a doctor might say, oh, you've obviously got dyspnea, you've got difficulty in breathing. Or you've heard of hysterectomy, you know, where The hyster refers to the uterus, and the ectomy removal through surgery. Or hyper, which is above or excess, and possibly some of you here have hypertension, which is high blood pressure. And then some others, for example, mal, meaning bad or abnormal. And, so you've got the illnesses like malaria or malignancy, and we'll talk a little bit more about malaria in another slide. So Mike, MYC, relating to fungus. So a mycologist is one who studies fungi. And, peri, which is around, so the periodontist treats the gum and tissues around the teeth. And this is just a diagram of a human body, and again, some root words. So just some that you might not, maybe aren't as common. The AUR relates to the ears, the oculo to the eyes, and the pulmon to the lungs. And something like, hepatitis, well, that's, causes inflammation of the liver. And just some common abbreviations. So, for example, ARF is acute renal failure. It might also be written down AKF, acute kidney failure. CCF and CHF, which is congestive cardiac or congestive heart failure. DVT, the deep venous thrombosis. And again, there's loads of abbreviations, and I know that we should always avoid abbreviations. Everything should be written out in full, but I'm sure you have found that you get abbreviations. The hash symbol means fracture, and NOF, neck of femur. So I don't know, like, are these sort of common to you, or is it really, or some, yeah. And SOB isn't silly old bastard, and I've actually got my great uncle Faustino's World War I record here, and he actually was an Anzac, and in the yellow box, and I've actually put it to the side here in case you couldn't read it, but I just wondered if you can make out what his issue was.
Gunshot wound to the left eye.
Gunshot wound, yeah. So he was a sergeant, he was admitted to hospital, gunshot wound, left thigh, severe. So that wasn't a hard one for you, was it? But anyway, he was eventually sent home as a TPI. And just some other facts about the war records and vaccination in particular. You probably are aware that during World War I, the major killer of the soldiers were infections, particularly the gastrointestinal and the respiratory. Some vaccines were available to soldiers in World War I for plague, tetanus, smallpox and rabies. But during World War II, the major killer of the soldiers was combat. And of course, by now, penicillin was in use, particularly for the soldiers, and, saved literally thousands of lives. So the following slides relate to the cause of death over the past 200 years. So in the UK, in the late 1800s and early 1900s, again, the main cause of death, infections. So TB or tuberculosis, and that's for all age groups, pneumonia and measles. And then in Australia, we also had the influenza and the gastro and the smallpox. And in fact, in 1798, it's estimated that 70% of the Indigenous population were killed by smallpox. So you can see that TB in particular, is sort of common in both those countries. And then I thought, well, how on earth did people survive when they were chronically ill, or if the breadwinner actually died? And that will be just on the slide after this, but with tuberculosis, there was a real peak around 1907, and then around 1920, that was when they started building the chest hospitals to actually isolate people who had TB. And then there was a post-war national tuberculosis campaign. So you can see how the rates have, you know, really dropped, which is great. Free X-rays were provided and medical care and an allowance while being treated. But can I just say, not everybody was equal. So in 1908, we actually had a national age and invalid pension legislation. But for example, in our state, every person, unless they were Aboriginal, alien or Asiatic, and were over 60 years, resident of New South Wales for 15 years, and earning less than £50 a year, they received 10 shillings a week if single and 15 shillings if married. And that was actually regarded as quite generous. Now, a whole 50 years later was when Aboriginal people were eligible to apply for a pension. But the thing is, many of them did not understand English. English was not their first language. They weren't allowed to be nomadic. And so a lot of the Aboriginal people, they were mustering, for example. They also, well, some of them didn't even know their date of birth. So they had no idea really how old they were. They couldn't prove that they were over 60. And also they had to apply to the policeman or the local magistrate. So I think you can see there were real barriers there for Aboriginal people to actually apply for the pension. So certainly not everybody in 1908, you know, got the pension if they really were eligible for it.
Louise, I have a vague feeling there was something also I remember reading where it said you had to be, I don't think they gave it to alcoholics.
Oh, is that right?
Yeah, there was something you had,
Yeah.
I can't remember the term, there was a set term where you, not clean living, lots of people drink, but,
Sober or,
or whatever, but, you know, you weren't.
Okay. Oh, that,
Yeah, I don't know. Yeah,
You could, that could be quite true. Yeah, but I haven't sort of come across that. And so I'm giving you some more trend data again, you know, because you might be sort of researching your family and of course you can see how infants, you know, high death rate. So in 1860 with infants, and an infant is from 0 to 1 year of age, there were 391 deaths per 1,000 live births. And then you can see how it has really dropped, you know, in 1915 down to 70, and then 2020 down to 4 per 1,000. So thankfully the infant mortality rate has really dropped. Now, I'm not sure if you've ever heard of what a vaccine preventable death is, but it's basically a death that could be avoided through vaccination. And vaccines really do save lives. And for example, with this slide, there was a peak in deaths in World War I. But then as all these immunisation programs were introduced, the rates just dropped and dropped and dropped. So in 1932, we had the diphtheria vaccination commenced, and then followed by tetanus in 1939, and then whooping cough, which is pertussis, and then polio in 1955, and then measles in 1970. So again, you can see they've really dropped down to almost nothing. Now, maternal deaths, now the definition of a maternal death is death of a woman while pregnant or within 42 days of the end of pregnancy. So in the 1900s, there were 600 deaths per 100,000 births, and a third were from infections. So the death rates dropped rapidly after the introduction of antibiotics, thank goodness. And then in 2020, the rate is down to 5.5 per 100,000. So in that year, that equated to 16 women in this country. And that was that they died because of sepsis, heart disease, or blood clots. So luckily the death rate has actually dropped quite a lot. So at the moment, the current top causes of death in Australia are ischemic heart disease, which is narrowing of the arteries, dementia, cerebrovascular disease, and that includes coronary heart disease, stroke and lung failure, and lung cancer. Now, in relation to dementia, though, I just want you to be aware, I know that in this graph, it looks like, oh, you know, it really is increasing for both genders, male and females, but we have to be aware that in 2006, there were coding changes. So we have to just realise that most of us in this room won't get dementia, and most of us actually stay in our own home. You know, we don't end up in a nursing home. So I think we've just got to be a bit cautious when you actually look at some of these graphs. So purely an administrative change sort of saw this kind of increase in dementia that looks a bit sort of shocking. And now we'll look at some obsolete medical terms for diseases, and you might have already heard of some of these, and I'm sure that you've got loads of others that you'd be able to, you know, inform the rest here today about. But for example, ague, that is fever and chills, or malaria, and malaria was also called marsh fever. And what happened with malaria, the residents south of Rome who lived in a marshy area, they actually, and this is in the medieval times, they actually found that every summer they were coming down with fevers and chills, and they actually thought it was the bad air they were breathing, and that's where the word malaria comes from, you know, bad air. But in fact, it was malaria caused by the mosquitoes, and something like biliousness, you know, which is what we know as jaundice, and the bilious remitting fever, which is dengue fever. Bloody flux was dysentery, and the Black Death caused bubonic plague, and the bubonic plague is actually still around, and it's a very nasty illness. You basically have, you know, all your organs just rotting within about the first week of being infected. And there were 5 cases of the plague in America in 2020, so it is still around. And this is a picture of the Marseille plague doctor, and you can see maybe that's the first use of PPE. You know, you can see the mask and that nose bag. They would fill it with herbs like lavender and peppermint, because you know they thought that would actually protect them from the Black Death. So how serious was the Black Death? Well, it was very serious actually. It was a 300-year pandemic, and there were up to 200 million people died from it. And this bill of mortality, and Pat Hurley actually gave me this slide, so I'm grateful to her for it. This is from just a small area of London, and it's a bill of mortality for 1 week in 1664. And of the 8,297 deaths, 86% of them were from the plague. And then the next 3 main causes of death was fever, consumption, and teeth. And of course, that's rotting teeth. So, and again, if you get rotting teeth and it's not treated with antibiotics, you can get the heart problems. So, but anyway, that is a big difference, you know, from yes, over 7,000 of the plague, and then followed by these ones here. Just some other obsolete medical terms for diseases. So brain fever, you might hear that or read that phrase, and that's meningitis. Barrel fever. And you probably have all heard of black dog depression. And camp fever is typhus, and that's caused by the fleas and the mites. And it occurs in crowded conditions, you know, like convicts on ships coming out would have ended up with typhus, or in jail. And this is a picture of an adolescent with typhus. Other things like canine madness, which is raising, and consumption. Well, that had lots of different terms. So, you know, tuberculosis, of course, we know it as. It also was called typhus, so a silent pH, or, you know, wasting disease, lung sickness. It had lots of terms. And you can see this patient here is wasting away with consumption, surrounded by 4 female attendants. So I think you can see who the next ones were to come down with the consumption. Of course, it was the women, because they were doing the caring that's spread by droplets. So you could have the death from teething and due to oral infections, diarrhea of the urine, which is diabetes. Things like, you know, domestic malady, which is depression or emotional breakdown. Probably only the women. Sorry? Probably only the women had that one.
No wonder they were depressed.
Probably. Then, of course, dropsy or edema, and that's a picture of somebody with dropsy. So falling sickness, which is epilepsy, also known as Jackson's March, French pox or French disease, which of course is syphilis. Now, it was also known as German pox, pox or Naples disease, so I think it depended on what
I wonder where they called it English.
I think it depends. If you were French, you wouldn't get French pox, you'd get German pox.
Yeah. I'm just wondering what would be English pox.
So green sickness is anemia. You might also see the word sclerosis, or grip is influenza, and in fact that is the French term. La grippe is French influenza. Leprosy, well, that is actually Hansen's disease, and I've got a picture here of a patient with Hansen's disease, and of course leprosy is still around, you know, particularly in places like India. Now I've got a couple of death certificates to show you. So this one, the cause of death is general paralysis of insanity. Well, that's basically tertiary syphilis. And I don't know if any of you saw the Who Do You Think You Are episode with Kerry Ann Kennelly. One of her ancestors actually had this down, GPI down as cause of death. And then when the wife died, that was left blank. And the genealogist felt that the reason why that lady's cause of death was left blank was that she probably had tertiary syphilis too, but it was to preserve her dignity, you know. So I thought that was interesting. I watched that one fairly recently. Just some other ones. Lockjaw is tetanus, because that is one of the things that happens. They actually, one of the first signs is that their jaw can't move, and then they get paralysed. Mad cow disease, that's Creutzfeldt-Jakob disease. And in Australia, we did actually have 51 cases in 2020, but no deaths for many years. But the UK has had deaths from mad cow disease, which is unfortunate. And the last one was in 2019. Marasmus is severe malnutrition. Nostalgia, homesickness, and they say that you can die from that. Putrid fever is diphtheria. And this is cause of death. This was with a male baby, 5 months old, and they've got the cause of death as marasmus and exhaustion. Now, look, I really don't think they'd have in a current death certificate the word marasmus. They'd probably say severe malnutrition. And then some others, St. Vitus dance, and St. Vitus was the patron saint of dancers, and in that condition they actually have muscle spasm, but it is now known as Sydenham chorea. Spontaneous combustion from drinking brandy.
I love that. I think that's brilliant.
I like that one.
What a way to go.
Or the shakes, which is Parkinson's disease. The vapors covers a range of many mental and physical illnesses, including measles. You might also see the word effluvia or visitation by Angola, death due to natural causes, and winter fever, which is pneumonia, also known as old person's friend. Oh. So I'm sure that there'd be many of you here tonight who would have other terms that they've come across.
Yeah.
Do you want other ones?
Enteric fever.
Enteric fever. Oh, okay. Well, that would be.
I think it was typhoid, don't it?
Yeah, it could well be typhoid. I'd say it definitely would involve a lot of diarrhea. Yeah. But yes, I have heard of that one. Any others that you've heard of? I know someone's got a book here with all those terms. There'd be literally hundreds.
Blackwater fever, I found recently. Blackwater fever.
Yes, okay.
Very serious side effect of malaria.
Oh, okay.
A soldier who served in New Guinea.
Right, and I have a feeling that the urine turns black. That's where that comes from.
Maybe.
So that is actually the end of my talk, and I hope I haven't rushed it tonight. But do any of you have any questions? And I'll certainly try to answer them, but I don't promise, I don't know everything, that's for sure.
That very first one, for blindness, I'd never heard.
That's because of the eyelid. The eyelids, something like that, isn't it?
Is that?
Because a blephary or something is when you have the eyelid surgery.
Yes, I was trying to work out what it
Yeah.
would come from.
Yes.
Yes, the very first one, and
That must have been much earlier.
yes, it was the very
first.
yes. Yeah. Oh. Interesting one.
So what about other research that you've done? Have you come across other, curly ones that you can't find on?
I came across an interesting one on the death certificate of my father's twin sisters.
Oh, right.
Inundation, which was the wasting disease because the mother was had malnutrition.
Oh, okay.
I had to go digging into that
Well,
one.
that one, yeah, actually, I haven't heard of that. Oh, so that would be, so was it the child that had the inundation?
Yes, both of the children.
Okay.
They died a month apart.
Oh, right, okay. So that would be like the Erasmus. Yeah. Any other comments or queries? Okay, well, look, thank you for being such an attentive audience, and I'm really pleased that I have been able to come tonight and COVID free and all that sort of thing. So thank you for your attention.
Oh.